as well. Welcome to the Alberta Association on Gerontology's Futures Policy Forum. This is Webinar 6, Valuing Care and Family Caregivers. I'm Sharon Anderson. I'm the Secretary of the Alberta Association on Gerontology. There's many meanings to valuing care and family caregivers. At our 2018 consultation, Dr. Rhoda McRae of the University of West Scotland, who teaches the Scottish Dementia Champions program to reduce stigma and help people to live well with dementia, said we need to value care as much as we value cure. So are we valuing family caregivers and their care? Dr. Carrie Kaluski says caregivers' work has been described as largely invisible, unfairly distributed, and has a huge effect on their opportunities in life. I also want to point out that the value of caregiving just made the Davos World Economic Forum yesterday. The U.S. care economy today, given historic labor shortages and compounding economic challenges in the wake of the COVID-19 pandemic, a massive chunk of the U.S. growth is at risk unless business and government leaders come together to address the caregiving crisis. So I want to acknowledge that we live on the lands. I'm in Edmonton, so it's located within Treaty 6 territory and within the Métis Homelands and Métis Nation of Region 4, Alberta. So the Alberta Association on Gerontology acknowledges its presence on the lands of the Indigenous people across Alberta. We're committed to an ongoing dialogue and sharing learning to achieve healthy aging and quality of life for all Albertans. And particularly, I want to shout out to the Aboriginal caregivers because they really work hard. It's my pleasure to introduce our platinum sponsor, West End Seniors Association, Lorena Smalley, to tell us about this incredibly busy senior center.
Hi, everyone. My name is Lorena Smalley, and I work at the West End Seniors Activity Center in Edmonton under the leadership of our Executive Director, Dr. Haydong Liang. We are a very busy center. We're a multi-purpose facility. We have over 22,000 square feet, and we're located in the West End near West Edmonton Mall. And we serve as a community hub for people aged 55 plus. Like I said, we're a really busy center. We have over 1,700 members. Many of our members are coming to our center 2-3 times a week for those activities. We offer over 100 registered programs and drop-in activities. And we also host a number of events throughout the year that are meant to engage seniors. Often our events, things like an amazing race that we held 2 years in a row now, it's not uncommon for us to have 100, 200 seniors participate in our events. We also provide support services throughout the community as well, with our community outreach and our volunteer programs. Prior to the pandemic, we had something like 200 volunteers that help run our organization. And I'm really proud to say that this year we're going to be celebrating our 45th anniversary here in Edmonton. And I'll just wrap it up by telling you another I guess, success story of Dr. Liang's is that in June of 2022, our center was awarded a 3-year contract to create a community hub for seniors in Strathcona County. So we're going to be working with a variety of organizations in the county to assist them with coordinating information, activities, and providing whatever assistance we can to create a network for seniors out in that county.
Thank you very much. Great overview of the West End Seniors Association. So to put this webinar in context, according to the 2021 census, Albertans over 65 make up about 14.8% of Alberta's population. This is the Alberta Association on Gerontology is using the improving quality of life for residents in facility-based continuing care figure. So there's 3 levels of policy to achieve healthy aging, starting at level 3. So here at the bottom, about 6.8% of Albertans over 65 reside in seniors' residences as lodges, supportive living or long-term care. And that rises to 30% of those 85 years of age and older. 93.2% live in the community. But at level 2, of those 93.2%, 29% have moderately complex conditions and 17% have highly complex conditions. Family caregivers provide 75 to 90% of the care for people living in the community and assist with 30%, 15 to 30% of the care in long-term care, congregate care. So I just want to talk for just a second about this because we're going to hear a lot about statistics today and those kinds of things, but family caregivers are diverse, and diversity is much more than language, race, or culture. All of those things like caregiver age, education, socioeconomic status, whether somebody lives in the West End of Edmonton and goes to the West End Senior Centre or way out in Cooking Lake in Strathcona County, makes a big difference. So you have to think about all the conditions and the care trajectories and how that would be very different for different caregivers. So looking at this trajectory, the differences for somebody that's had a stroke or heart attack may start with personal care and move to long-term care, or it can get better. Somebody with frailty or dementia may start right at the very beginning with some sporadic care, maybe just a little bit of driving, some help with banking or something like that, and then it becomes more onerous. And often people have more than one condition. So it's not just dementia, it's often dementia and Parkinson's and depression or other things. So healthcare providers and health and social care providers should want to know if somebody has a family caregiver, who doesn't have a family caregiver, chosen family, friend, or neighbor to care. And as well, as Stephen Zaret says, he's of the caregiver burden scale says, caregivers need person-centered care. So I also want to point out that because of that long trajectory and all those different care, family caregivers need support from a wide variety of health and social care providers. So we really need an integrated collective impact approach. Policies, communities that are child, disability, dementia, and age-friendly would make it easier. Community organizations like Caregivers Alberta, senior centers, the research and the health system also have a role to play in supporting family caregivers. Research and evaluation tell us what's needed and what's working, and about 52% of caregivers' needs are non-medical, but the care receiver's health is what triggered the caregiving. Health providers have a role in supporting family caregivers. And with that, I'll get down off my soapbox. And I want to introduce the speakers. So first, Jane Badets is going to make us all smarter about why the care economy has made the World Economic Forum at Davos. And then Janet Fast, who I know personally is one of the best university professors at the University of Alberta, is going to speak about the economic value of that care work. Dr. Lewanchuk, who's working on the modernizing Alberta's primary healthcare system, is going to bring us up to speed on supporting family caregivers as more care is moved into the community from hospitals to home. And Jonna Lowther, who sees and feels family caregiving situations daily, is going to talk about Caregivers Alberta and supporting family caregivers. And with that, Jordana is going to share Jane's slides, and we're off to a start here.
So I think I've got the floor now, and you can hear me. So, my name is Jane Badets. I've currently working at Statistics Canada, but I had a long career. I actually came back to work on the care economy. We were asked, what is a care economy? Why is it important? And what do we need in terms of data? So I'm very glad to participate today, and I thank Sharon Anderson and all the organizations and the individuals who have been making this webinar possible. It's a very important topic. So I'm going to talk more broadly. I guess I am going to set context. I'm going to talk about the project I'm leading, which we were wanting to develop a conceptual model of the care economy. One that can be used in data measurement. So data is very important. What is the data that we do need? What's the data that we have? And where are the data gaps? So I will talk about that. I'll talk about why it's important to show some data and just basically tell you where we're going to the next steps. So first I'm going to start, I'm going to just try and talk about what is the care economy, because there wasn't consensus when we looked at all of this. We've worked with a lot of experts such as Janet Fast and Nora Keating and many across this country and other organizations. We have adapted a definition of the care economy based on the International Labour Organization, Ito Peng's work out of the University of Toronto, and she's leading a 9-country project on the care economy, and UN Women publications. So I'm just going to read this. This is very important. The care economy is that sector of the broader economy comprising the provision of paid and unpaid care work. Those two domains are very important. That supports the physical, psychological, and emotional needs of care-dependent persons. Who are the care-dependent persons in the care economy? This is a broader look at the care economy. Children under the age of 15 because of their young age needing support. But in terms of adults, it's those what we call care-dependent adults, those over the age of 15 with long-term, can be health or mental health conditions, persons with disabilities, or as they age, they may have other limitations because of aging. So that is our population. Both these groups require, whether it's paid help or unpaid help, really with activities of daily living to live independently. So it's broader than just those who are aging. In fact, this goes across the life course. So you may have now elderly parents looking after adult children with disabilities. So across the life course, it's very important to look at that aspect. Oh, next. So I will just briefly, public policy perspectives. I think Sharon very aptly described why all this is important. This is a national view. So we have some new organizations such as the Canadian Centre for Caregiving Excellence making that statement. Federal budget in 2021, interestingly, they talked about the care economy. They didn't find it, but they talked about care in many different aspects of care nearly 400 times. So you can see how this is working into a national discourse. We have organizations such as Canadian Labour Congress and Oxfam Canada looking at this. And Statistics Canada has also appeared before parliamentary committees. And specifically, I put up this recommendation that we've been asked to collect data on and track unpaid caregiving work across all regions across Canada. So that just provides you some context. So why is it important? The ILO projects 2.3 billion people will need care by 2030. Women, especially migrant and racialized women, do the majority of care work. Often this is invisible. Pandemic has shed lights on the crisis of care, but it's long existed. The invisibility of unpaid care has long existed before that. I just have cited the Canadian Medical Association about doubling of annual long-term care and long-term and home care. It touches on a number of topics: gender diversity, inclusion, families and social support, of course, aging, but where care is provided, long-term care, community, and home care. So I wanted to provide you some most recent data. So Statistics Canada, we conducted in the summer, it's a Canadian social survey, and we added 20 some questions around the care economy, whether it's paid or unpaid care, caregiving, it's for adults or children. So this is very recent data, and we will be mining this data more. But 15 million people in Canada at that time in 2022 were providing care, whether it's to children or care-dependent adults. 1 in 2 women in Canada, 42% of men. A third of Canadians provided some form of care to children, and a quarter of Canadians provided some form of care to care-dependent adults. So you can see the impact on the Canadian population. And in fact, it said it's whether you're providing care today or needing care. And in terms of the life course, most individuals would either provide care or need care in the future. I thought I would also, it was mentioned about the 2021 census. I thought it would be good to look at some of the demographic trends, especially about families and households, living arrangements, because we know an unpaid care is often with family members. So what is that family structure? This has implications how care gets delivered today and tomorrow. So on the one hand, we're seeing smaller households and tending to be older households. In fact, now one-person households is the dominant type in Canada. And there's some more statistics there, almost entirely explained by population aging. 42% of the population aged 85 and older in private households lived alone. And this is the population, the older population, most likely because of health issues, they need support, more support. And that number is only expected to triple and by 2068. So this is, of course, this is important because it, what are the family structures going forward are going to provide that care. Kinlessness has come up, and it is, as we have more one-person households, people are more likely to be without immediate family to help them as they age. And so this is an important trend. In fact, there was a study on kinlessness around the world, and Canada had the fourth highest percentage of older people without kin. So there's that on one side. On the other side, we're seeing rise in multiple family households. So that are households with multiple families or family plus additional persons and multi-generational. We know multi-generational, most frequent among Indigenous, immigrant, racialized groups. So that looks good. I mean, it looks like there's a good family support within generations within a household. However, we do know that there could be language or cultural barriers to accessing broader social support and broader support networks. So that's something to consider. Unpaid care work is valuable. I know Janet is going to, is going to talk a little bit more about this, but I just want to say the systems of national account in Canada and many countries, that system which produces the GDP, unpaid work is outside of that. It's not part of it, it's invisible. Now, we have had a recent study by Statistics Canada which value the unpaid household work, but not necessarily just care work. So it could be broader, it could be narrower. Then Janet's going to talk about the work she has done. But at the end of the day, we have a major data gap. We don't know the value of unpaid care for children, but also we don't know that value to the economy of the total care economy, paid or unpaid. So there's a major data gap. I'll just turn now to talking about what Stats Canada is doing. So we started this project, looked at the research, environmental scan, what do we mean by care and the care economy, and we worked with a number of experts, and we framed a conceptual model, what do we need to measure, and then the data mapping and data strategy is our next step. We're in the process, but we need to identify how we're going to measure, what is the roadmap that we need going forward on this important topic. This is our conceptual model. It is, I've talked to you about the care economy, what care work is, care dependent groups, paid care, of course, for remuneration, performed in social care, some overlap with healthcare, and then childcare. This, interestingly, has been the biggest data gap we have found, because it's hard to put those boundaries around those providing care, let's say to care-dependent adults. Who is that group? How do we value or find data on the home care industry, which tends to be a bit opaque, and personal support workers? So that is something we're looking at. Unpaid care, of course, caregiving, that's a personal relationship. You're either providing it to as a friend, neighbor, or a family member, but also voluntary organizations. So we need to consider those as well. Location of care is also important. And so my last slide is, we came up with some key questions. Of course, there's many questions, but these are some where we need more data, or that we have data and we need to expand on it. Who provides paid or unpaid care in Canada proved to be, like, that's ground zero for me, but it proved to be more difficult, especially on paid care. The quality of care, of course, there I mean by, its intensity and duration. Is it 24/7, or is what continuum of care is being provided? Or is it, I'm helping my parents go to, keep up their house or do their finances. But we need to know that continuum of care, the intensity of care. Care receivers is important. The impacts of caregiving is essential. We need to know this, whether the impacts on health, whether it's financial, whether it's on the well-being of the care, especially on paid caregivers, and their labor market opportunities. So that's really important. Unmet care needs, what supports, and I'll just conclude with the magnitude of the economic contribution of the care economy being one of the major data gaps. Well, thank you, and I look forward to the questions.
Thanks very, very much, Jane. And Janet's going to get her slides ready there. And this has been really important. If we don't have that data, we don't know what needs to be done or what's really happening out there. So without further ado, Janet Fast.
Okay, so I'm unmuted, my camera is on, and my slides are up, I hope. Thanks, Jane, for that introduction. I think Jane knows that we have answers for a number of the questions that she posed in that last slide, but there some of them are more complete than others, and there certainly are knowledge gaps around many of the questions that arise, the questions that need to be answered about the care economy. And that's really been a fairly key focus of my own research program for some time. Okay, so there we go. So just so we're all on the same page, we're talking about care that is provided by family members and friends, as Sharon indicated earlier. A lot of the, and as Jane alluded to, a lot of the care that family members and friends provide is really invisible. It's invisible, and that's a problem. I think that's an important thing to understand. It's a problem because it's considered to be free. If you don't see it, you don't value it. It's viewed as free labor, and so it's fair game to develop policies and practices that basically download the responsibility for care to family members. Not that family members are trying to shirk any responsibilities. They participate in caregiving because they feel an obligation or a duty to the person that they're caring for, and they typically do it willingly, although they don't necessarily feel like they have a choice in the matter. The other problem is that it then is seen as being supplemental, and you see many references to this in the materials that we read about family caregiving, that it's seen as being supplemental to the formal care sector. when it really, in fact, the formal care sector is supplemental to family care, because families care, as Sharon also pointed out earlier, provide between 75 and 90%, depending on who's doing the estimate and under what conditions, of the care that we all receive. And so if anything is supplemental to anything, formal care is supplemental to family care. The other problem with care being invisible is that we don't then see the inequalities and inequities that exist within care provision either. We've done some work on this recently, and it is clear that the care workload is not shared equally. Even the family care workload or family and friend care workload is not shared equally across sectors of that the family care sector. And as a result, there's a reluctance to account for, in any substantive way, the contributions that the family care sector makes to the care economy and to their family members, to their friends, to their communities, and to the economy more broadly. The data from a different survey than the one that Jane was referring to, that drills down, provides very detailed data on family caregiving in Canada. According to that survey, about 25% of all Canadians and Albertans are family caregivers, or were family caregivers in the year prior to the survey being conducted. They provide care because of other people's chronic health conditions, disabilities, functional limitations. So they provide care to people who need care support. And typically they have some kind of personal connection to either family members or non-family members for whom they are providing care. They can be all ages, from all parts of the country, from all parts of the socioeconomic spectrum, and there's a lot of variability. So there's a lot of variability in the population of caregivers, but there's also another form of diversity that we've discovered recently, is the care trajectories, the history of caregiving that different caregivers have, and that makes a difference to outcomes for them as well. I'm going to provide you primarily with data from Alberta, since that's where we're broadcasting from, but we have equivalent information on all family and friend caregivers in Canada in other documents. We have found that in 2018, Alberta caregivers spent an average of 15 hours a week on providing care to family members and friends. This is a massive increase since the last survey that we analyzed, which was conducted in 2012. And you know, the time spent is probably, I think, about doubled since that time, maybe a little more than doubled. And that amounts to, if you think about that as if you had to hire somebody to provide that care, you'd have to hire somebody for 2 days a week in order to substitute for that care. And for the caregiver, of course, that's 2 days a week, that 2 workday equivalents a week that they can't spend on other activities. In Alberta, if you aggregate that to the population level, we're talking 647 million hours per year, which is the equivalent of almost 350 paid support workers. I'm an economist, so I like numbers, and I especially like dollar signs. And so one of the things that I've done, and my research team has been doing fairly recently, is estimating what the value of that, of all of those hours of care would be. And we asked the question, because we're really trying to provide information that would be useful for policy decision-making and practice decision-making, we take the perspective of what would it cost to replace all of the family and friend caregivers work with paid care providers. And in 2018, using the average provincial wage rate for a care worker, we estimated that replacement cost at about $12 billion per year. As I said, we've done national estimates on this, and the national estimate is between $97 and $112 billion per year. That $12 billion estimated replacement cost amounts to a third of the total healthcare spending in Alberta. And we use the 2021 number because that's all we could find. But nonetheless, almost a third of the value of all healthcare spending in Alberta, all healthcare spending, not just continuing care, not just home care, but all healthcare spending. And that represents about 4.2% of the total GDP for Alberta, and 3 times public spending on continuing care services. And that includes home care and long-term care type formal care. We went on to then ask, well, how are these contributions? So we're viewing that $12 billion as caregivers' contribution to the economy, to society in Alberta. So we went on to ask, so how are those contributions distributed across types of caregivers? And we found, not surprisingly, that the bulk of that contribution comes from women, although not quite as big a share as you might think. It comes from the lowest income caregivers. It comes from caregivers who co-reside with the person that they're caring for. And it comes from baby boomers. If we look at the different generations of caregivers, the biggest contributors are baby boomers. So why do we need to know what the monetary value is? Why attach a dollar figure to this? Well, for one thing, it just makes the care that's being provided that much more visible. So you attach a dollar figure to it, and you can then look at it in the context of the care economy, of the broader picture of who's providing the care and how are the costs of providing care distributed across stakeholders, in particular distributed across family and friend caregivers and public sector services. And as a result, we see where the inequities are in how the contributions are distributed. It also, I think, exposes the risks of shifting costs from one sector to the other, and in particular, shifting costs from the public sector to the private sector, to the private family sphere. Because policymakers talk about their efforts to reduce the cost of care. Primarily, they're talking about the cost of care to the public system. And as an economist, I understand, and I want everybody else to understand, that costs don't go away. They just get transferred from one stakeholder or one sector of the economy to another. And that's what happens when responsibility for care is transferred from the public sector to the private family sector. And that's really where I wanted to stop. I'm happy to answer questions, happy to point you to other resources, but we'll turn it over, I think, to Richard next.
Thank you very much, Janet. And there's all kinds of people saying this is great. lots of interaction in the question and answer. And without further ado, Dr. Lewanchuk.
Thanks very much. I'm just going to move my slides here. So I'm from Alberta Health Services, and I work in an area where our mantra or our mission statement is really to help Albertans be as healthy, well, and independent as they can be in their homes and communities, because that's what we hear that Albertans want. We're at the Robert Frost Junction here with the road more traveled and the road less traveled. I'm going to go down both roads for us. The first road I'm going to go down is the road more traveled and give you a little bit of a perspective of why family caregiving is important or has impact from the healthcare system, the classic healthcare system. So we know that about 5% of the population or about 2/3 of healthcare costs are attributable to 5% of the population. And before we think of that in a pejorative term, I should mention that we will all be part of that 5% at some point in our lives. And so the question arises, who is that 5% of the population to whom 2/3 of the healthcare costs are attributable? And it turns out that it is older people, frail, elderly, and older people with multiple chronic conditions that form the majority of that 5%. So the question then arises is, why does it cost so much? And the reason is because these people end up in hospital more frequently. So they represent the biggest proportion of the hospital population or hospital bed days. And of course, hospitalization is the most expensive thing that we can do in a healthcare system. The question then goes on to, why do they end up in hospital? And this is where a fatal flaw is often made, because if we go to our healthcare data, we run into, or we get the following sort of results, which says that people are in hospital for the following diseases. But it turns out that isn't really quite true. If you actually dig down to the cause behind the cause, what we find out is the following. And we did this by going to the smallest and the largest hospitals in Alberta and literally saying, why are these people, why is this person in hospital? And what we heard time and time again, independent of the size of the hospital, was something along the line of the following, is, well, medically, maybe this person didn't need to be in hospital, but what? But I couldn't send them home. But I knew they weren't managing at home. But I knew if I sent them home, they'd be right back. What we were really hearing was that it wasn't so much the medical aspect, but it was the care aspect and the ability to provide care at home. Well, and I apologize, to me, it looks like my slides aren't quite coming out exactly the way they should be in terms of coloring. But if you then ask the question, well, who provides care? Well, it may come as a shock to us that the healthcare system only provides somewhere between about 3 to 5% of care. The largest proportion of care, 90% of care, is provided in the form of family caregiving or self-care. And the largest chunk of that is actually the family caregiving. And so from a healthcare system perspective, that's really important, because the following tends to occur. So here's the classic trajectory of what has happened historically. And that is, someone is at home, someone aging or starting to run into troubles. The family caregiver, family caregiver's family, whatever the community resources are, try to manage, but eventually they can't cope. And so the ambulance is called, or the person is put into the car, taken to the emergency department. And that's where the physicians say, well, I can't send this person home because they're not managing, ends up in hospital, and from hospital into some form of a care facility. And this is really important, the top level of, the family caregiver not being able to manage or being burnt out, as we've heard, and needing to go to hospital, because the problem is there really is no alternative. We might say, even though we monetize by saying, well, this is how much we'd have to pay for another caregiver, the problem is those caregivers don't exist to hire in the first place. Huge shortage of personal care workers, healthcare aides, even home care nurses. So then our only alternative is emergency department, hospital, long-term care, which we know is first very expensive, and secondly, not where people want to end up. So just very briefly, if we do the math, and the math has been done from the healthcare system, we can say, yeah, if we are able to keep people at home, support family caregivers, and the right white column that even takes into account lost productivity. Even if we monetize that, it's cheaper to support family caregivers and keep people at home than to have to rely on institutionalization. So from a healthcare perspective, if we support family caregivers, it will reduce healthcare system utilization and costs. But let's look at the road less traveled, because in healthcare, sometimes we think a little bit too much about costs. So the purpose of our healthcare system isn't to reduce costs, it's to look after people or to provide care. So I don't know how many people have heard about the triple aim or then the quadruple aim, or even now the quintuple aim. And this just speaks to why do we do things in healthcare? We do things in healthcare so that the individual has a better experience and we actually improve the wellness and health of an individual. We do it so that we improve the health of populations and improve outcomes. We do it so that we can better use our resources. We used to say to lower costs, but I think we've matured beyond that. We say, and we've added the quadruple part to the triple aim to get quadruple aim, basically to provide or improve clinician well-being or clinician experience, although I'd say more provider experience. And more recently, also to even out the unevenness, to improve health equity. In Alberta Health Services, when we plan now, we don't think in terms of our whole goal is to reduce costs. We think of what can we do to enable Albertans to be full partners, to meet Albertans' needs, improve their health, and to reduce this reliance on acute care and facility-based care, and to interact better with the community and primary care, and to maximize our use of technology to do this, or use technology. So we know that in the last 2 years, based on at least 4 surveys that have been carried out in Alberta and Canada, somewhere between 91 to 100% of Canadians and Albertans want to live the entirety of their lives in their homes and in their communities. The other thing is we often hear, sometimes hear that from the population at large, or from some individuals, well, that, well, most caregivers, it's a burden to them. And so actually going into a facility is what the caregiver wants. And that is not true. Most family caregivers would like to continue to look after a loved one in the home and community, but often end up in this position where they just physically, mentally cannot do that. And when they are unable to do that, that's when it's the emergency department, hospital, and facility-based care. So let's go back to our quintuple aim then. So it turns out that if we actually do help support family caregivers, what do we accomplish? Well, we enable people to stay in their home and in their community, which it turns out is actually better all around for that individual, from a medical perspective, a health perspective, a physical health, mental health, and emotional health perspective. So now it's not just about saving money, we're actually improving and maintaining the health of the individual. We're also able to even out the inequities so that everyone is able to stay in their home and community if we support the caregivers who otherwise wouldn't be able to manage through other means. We're also able to improve and reduce costs because it is cheaper and less expensive for people to manage at home than in a facility. And outcomes are better in the home and community. And here's where we had the quadruple part of the quadruple aim, caregiver experience. But what we also do is we enable and help meet the needs of the family caregiver who would like to keep their loved one at home. And so now we've enabled that. So we fulfilled all of the criteria of the quintuple aim by helping to support family caregivers. Well, how can we do that? Well, the system can do that, but individuals can do that. Community can do that as well. And I'm just showing you this is called the resilience model, but it's a very simple concept. And it really says that if we wanted to help someone, help a family caregiver, one of the things that we can do in this teeter-totter is when people are not able to cope, it's because the red boxes, the burdens exceed the supports. So if we can remove financial burdens, for example, or provide some respite, That removes burdens. That helps people and family caregivers manage. Or if we can add the green box supports, that also helps family caregivers manage. So that can help us think what we can do as family, individuals, or communities to help family caregivers. And we sometimes forget about community. And it's been said that community is a group of people that care about each other and feel they belong together. So do we necessarily need a formal Alberta Health Services or formal paid system to help family caregivers? What about the neighbor saying, you know what, I'll look after your loved one so you can have an afternoon off or an evening off, or I'll bring you a meal, or you come over for a visit. So as communities, we can help support family caregivers as well. It doesn't have to be a formalized system necessarily, because as has been said, you know, a healthcare system is just people looking after people. And I'll just finish with the following couple slides. In my job, if our hospital beds are filled, then I failed you. And finally, I won't say anything more, but I'll just leave you with this slide.
At the College of Licensed Practical Nurses event a couple of years ago, everybody said, we just need Dr. Lewanchuk to tell us how to change the system. He should be telling everybody how to do this. And so here we've had you. Thank you very much. And now, Jonna Lowther, who deals with family caregivers and that stress all the time. So Jonna, we're ready for you.
Hello, thank you for having me. Can you hear me?
Yep, perfect.
Okay, great. Okay. Yes, I am honored to be a part of this conversation and represent Caregivers Alberta here. It's nice that I get to end our presentation today and share from the heart and mouths of caregivers. I myself am one of those 1.2 million caregivers here in Alberta. And as we heard from previous speakers, the work of family caregivers has a monetary value. And 90% of healthcare being provided is happening as that informal care, either by a family or a friend or the individual themselves where possible. So today I'm going to share the practical impacts of what that looks like, caregiving. What kinds of things do we see? What are the barriers being faced? How we can help? And how can we as an entire ecosystem value care? Not cure, and the informal care that is propping up care for people who need it. So who are Alberta's caregivers? Family caregivers, it's already been mentioned that they are that shadow workforce of the society, and they are the backbone behind our healthcare system. And 1 in 4 Albertans is assisting a family member or friend with a challenge resulting from disability, illness, or aging needs. And at some point in their lives, nearly half of Canadians have provided care to a family member or a friend with a long-term health condition, disability, or aging needs. And those faces look like this. This is who we see and who we serve. We serve parents of children with disabilities. We serve adult children of seniors. Caregivers are spouses of someone with a disease, illness, or disability. And there are friends and neighbors, that non-formal family role that is providing care. The true cost of caregiving, we see these impacts in true cost every day in the services and the programs that Caregivers Alberta is providing. And the impact it has on individuals, we see the changing relationships that it causes the family. You know, we see caregivers caring for spouses with dementia, still living at home with a progressive illness, and these caregivers are unsure and they're scared about balancing the future. You know, parents caring for those adult children have been in that role a long time, and although they may be inspired by their children's resilience, they have a lot of mixed emotion around their own resilience. You know, we talked to long distance caregivers who are dealing with the normalcies of aging family members. And they recognize this is the next stage of life, but they're struggling to build this additional workload into their own schedules of family and work lives. Many caregivers are at the height of their career and their top earning years. And when they step away for aging relatives, it's their own financial stability that suffers. And as Dr. Fass, shared, our economy, suffers the impact as well. We see that effect. Caregivers usually find us as an organization, unfortunately, when they are already stressed, they are already overwhelmed, they don't know what to do, and they have already hit this burnout mode. But a lot of the work that we are doing right now is trying to build awareness and work with the healthcare system and work with other agencies and organizations and community-based services to find these caregivers before they hit the burnout mode. So to discover them. But when caregivers are in this mode, they are, there's a lack of energy, they're frequently sick, they're always tired, they're often neglecting their own personal health and wellness needs. They feel like they have a life dominated by caregiving, which really creeps into their mental health, not just their physical health. So, their physical health, these caregivers are at a higher risk of depression, anxiety, and stress. 39% of them say they feel overwhelmed. 42% say they feel short-tempered or irritable. 28% feel that they are somewhat or very stressed, and 26% report that their health has suffered. So stress is incremental and it builds slowly over time. So for caregivers who are in this long-term care relationship, those effects are even greater. I mentioned the financial impact. 51% of caregivers miss days of paid work, and that's missing on average 6.5 days a year unpaid. 18% of them are experiencing financial hardship. That's putting their current and future financial security at risk. 85% who are experiencing the financial hardship are dipping into their savings, their retirements, to pay for these extra costs. And so that's affecting not just the caregiver, it's affecting the care recipient, it's affecting the family, it's affecting the entire unit around that individual. There are physical challenges for caregivers because they often don't find the time to look after their own health. There's a lack of sleep, there's extra chores, heavy lifting, stress-related illnesses. I mentioned a compromised immune system. And, some caregivers that we talk to say, I just cannot get over being sick. I'm sick and I get better, and then a week later, I'm just back on the ground again because they're exhausted and they're fatigued and their body is literally fatigued. So Caregivers Alberta exist for those individuals, but I'm here today to talk about how can we all value the caregiver. And the previous speakers were saying the same thing. There's a benefit for all of us when caregivers are supported. Caregivers Alberta was founded in 2001 by caregivers for caregivers. It was a group of family caregivers that founded this organization, and we help caregivers connect with others, navigate the system, and look after themselves while providing care. Most caregiver programs out there are actually about the care recipient, about prognosis or treatment, how to care for them or how to understand the diagnosis better. Our programs are about the caregiver, their journey, their health and well-being. And, if caregivers aren't supported, they run the risk of becoming the next patient. So, we just heard some of that in the previous speaker. And then the question becomes, who is now providing that huge percentage of informal care to that person at home? I'll share quickly just a little bit about what is our direction, where are we headed as an organization, and what are we focused on, Caregivers Alberta? It is our goal that we are supporting caregivers through development and delivery of programs that actually address caregivers' needs. Caregivers' experiences and their stories inform our work. They are part of the collaborative process of sort of dictating our future path and the journey of where we're headed. We know it requires a lot of cooperation, collaboration from service organizations, from agencies, from families, from everyone, to build a caregiver-friendly community. And so we really strive here at Caregivers Alberta to raise the profile of and the public support for caregivers through advocacy efforts, and we try to be the thought leaders and the champions for caregiver recognition. And we do a lot of work with Sharon Anderson, who is probably one of the largest champions of caregivers. I mean, she's always out there tweeting everyone's what's going on in the world of all of us that have got to speak here today. So thank you, Sharon, for being that champion. These are just a few of our programs and services that we offer, just from a high level overview. This is a snapshot of the core programs that we're offering caregivers anywhere in Alberta, literally anywhere. COVID was a blessing in disguise for us, because people had to at least attempt what it was like to experience services in a virtual environment, in an online environment. And that has allowed us to expand our peer support communities, our program offerings into that online virtual space. And we have reached tons more caregivers across the province because of that. So super exciting. But the support line has always been the core service of what we have offered, which is a phone line that's a toll-free phone line, open Monday to Friday, typical business hours, 9 to 5. We're not a crisis center. We defer immediately for any services that are to that level, but we are that listening ear, and we are the peer that knows what it's like to be in that role as a caregiver. And that was the founding service that the organization was attempting to offer. Founded by caregivers for caregivers. We're here for you, and we understand. We do caregiver coaching. I'm going to talk about that in just a second. We offer education sessions, both to caregivers themselves, to professionals, and to the community at large. Caregivers Alberta can help reduce the angst and emotional fatigue that caregivers are experiencing. One of the most common pieces of feedback that we receive from caregivers is around how feeling supported by someone who understands their caregiving challenge actually makes a difference in their stress level. I have a testimonial from one of our caregivers that said, truly just connecting with someone who validated how emotionally and mentally difficult the role of the caregiver is helped me feel less stressed out. Feeling heard and told that the role of the caregiver is real and recognized by people in this organization, even though it may not be recognized by family or friends or even colleagues, but having this safe space to share and discuss how I'm feeling has made all the difference. And that is from the words, from the mouth of a caregiver that has accessed our programs and services. Our caregiver coaching is a new program that's come out during COVID time. And that wasn't the intention to launch during COVID. We were actually building it right before all that started. But nevertheless, it has been a wild success. I call it the next step up from just, a general support conversation, a general support line phone call. People can call us, they can email us, and get that immediate connection. And if they're looking for a particular resource in their area, we can help find that. So we help with that navigation. But if there's more going on, and there's more emotional stress, and they're having difficulty managing that stress, or balancing the relationships around that role, our staff will say, you know what, I think maybe we should schedule a coaching appointment. Would you like that? Would you be open to that? And so they get scheduled and put into our caregiver coaching program. It's a voluntary program. It is a free program. We are very grateful for the very generous support we've had from Alberta Health for the last 3 years, that has really built the foundation of this program completely, and has supported the programs and services that we are attempting to reach all across Alberta. We offer caregiver support communities. Those are our peer support groups. They're weekly small group sessions where again, people can connect with others who understand, but it's a peer. It is staff facilitated, but it is peer led. And the other things that we do is we were one of the many partners in the co-design process of the Caregiver Centered Care Education modules, which we are grateful to be one of those partners. And we're using this content in our Navigator program to facilitate conversations with healthcare and community-based service providers about recognizing the caregiver and the informal work that they do. We also recognize that caregivers make up 1/3 of the workforce, and we are now revamping a program called Work and Care that can provide education to employers and their employed caregivers here in Alberta. We also have created a contactless digital referral pathway. We work with agencies and healthcare and community-based services to get a direct referral link. So you can go to our website, there's a refer a caregiver button, and it's a built-in referral pathway that comes straight to our support staff. There's follow-up that happens, there's follow-up back to you who have made the referral. So please please reach out and ask how we could build even a more formal referral pathway with you. But as easy as it is to just go to the website and click that form and fill it out, it's very simple. And I'll just leave and close this presentation in saying that, caregiving impacts us all. There are only 4 kinds of people in this world: those who've been caregivers, those who are caregivers, those who will be caregivers, and those who will need a caregiver. So for Alberta to be noticed as a province where caregivers are valued, respected, and supported, it does require that closer working relationship across all sectors of health, government, private, and public and community-based services. So, please join us in that mission, and please help caregivers find us. And caregivers matter. If you're one of those unsung heroes doing the often unrecognized tasks in caregiving, you have my deepest respect. So thank you for what you do. And thank you, Sharon, for including me in this group.
Thank you very, very much, Jonna. We just love working with Caregivers Alberta. Across Alberta, we have a pan-Alberta cross-sectoral caregiver group. So we're all working together. Dr. Fast, Caregivers Alberta, the University of Alberta, our caregiver-centered care program to educate health providers, health and social care providers to support family caregivers. And this is unique in Canada, I think. I think Caregivers BC is doing that. Ontario is doing it, but we are doing really well. We're really innovative here in Alberta. So John is going to ask questions now, the ones that are in the chat, but I just want to start out. I see Lori has asked, she works in virtual care, and what can be done to support family caregivers? Maybe Dr. Lewanchuk and Janet and Jonna, do you want to weigh in first? So
Sorry.
Virtual care, they're providing virtual care. How can you support the family caregiver?
How do we support the caregiver through virtual care services?
Well, how should she support them if she's on that line, on that health line?
Sorry. Yeah, on the health line, if so you're providing that arm's length sort of care. The first thing is it's listening. You heard that testimonial that came from a caregiver, and it's being heard, it's being recognized, it's saying, oh gosh, yeah, you are doing a lot. That sounds so simple, but it is the number one thing that caregivers need to hear. They just need to feel heard and recognized. Yes, they need support. Yes, they need financial support, as was mentioned in earlier conversations, that they need all other different kinds of support too. But that's the first thing that anyone could do on the other end of a virtual support situation.
And Dr. Lewanchuk, as a doctor, because you have limited time, how do you do that?
Well, I was just going to say, yeah, that actually absolutely is the most important thing. We're trying to train and get all family physicians to ask the caregiver about just how they're doing. Quite often there's a reluctance on the part of healthcare professionals or family doctors to ask, because the reason is they say, well, if I say I'm not doing well, then I don't know what to do. Well, we just heard Caregivers Alberta offers a lot of resource. So we're trying to get every time a caregiver accompanies someone, we're trying to get the healthcare professional to ask the caregiver how they're doing, anything we can do for you or any help you need.
Thank you very much. Excellent. Janet, any suggestions?
Well, I'm involved in another research project that is focused on technology and aging, and I'm leading the work on assisted technologies for caregivers. And one of the big learnings on the technology side is that if you don't include caregivers in the design of the technologies that are being used, you really run a very high risk of not actually meeting the needs that the technology was designed to achieve. And that failure of technology for caregivers in particular is very, very high. So you may be providing technology assistance to caregivers and or to their the persons that they're caring for. But if the technology doesn't meet their needs, they're going to quit using it, or they're not going to use it effectively. or it's going to create more angst than it relieves. So there's work to be done on the design end of technologies that are supposed to support caregivers. The other thing we've learned is that technologies that are intended to support the care receiver sometimes support the care receiver quite nicely, but only because and if they have a family caregiver who will take on responsibility for making sure that the technology is working correctly, that it's being used correctly, and that puts an additional burden on the caregiver. So while it may be meeting needs for the care receiver, it's creating additional burden for the caregiver. So on the design side, there's still a lot of work to do.
Thank you. And Janet Smith has written she says, Sharon, as an Albertan who's heavily involved in family caregiving, I do not feel that we in Alberta are doing very well. I guess it's time I wrote about my experience and made it known for your organizations. And so, Jonna, because we certainly in our caregiver webinars that we did earlier in October and November, many people don't know about Caregivers Alberta. Many people don't know about the supports that are there. So how do you answer this when she says she's not, caregivers are not doing well, we're not doing enough?
Yeah, I just answered a question in the chat box that asked about Caregivers Alberta's capacity to offset finances. And I said, no, I wish that was, a service that we were, a capacity to do so. No, we don't have the capacity to do that. But that is, that's why we work to share the stories of what's happening so that people hear about, the reality of what's going on in the home of family caregivers. That's the most important thing I think we can do to advocate, is just to get that out there and talk about it and promote the collaboration and working together. Like the people, on the screen today, it's like we're a very valuable group of individuals that can, hopefully promote change and create pathways for change, just to better support Albertan caregivers.
All right. Jordana, you want to go down some of the questions that are in the question and answer box?
Sure thing. There's some good conversation happening there. It's really hard to keep up. So this question is from Jenny. What is stopping Canada from implementing guaranteed basic income for caregivers? When any care recipient is sent home, what is stopping us from sending the necessary support with the care recipient to be received by the family caregiver? I'll open that to the floor.
Janet or Jane? Janet?
Sorry, I'm muted, so I wouldn't subject you to the noises my cat's making. There's a pretty simple answer to that, and it's money. The system just doesn't have the funds to provide those kinds of supports, and there's a philosophical objection, frankly, among some policymakers to providing those kinds of supports. There certainly is a philosophical objection from among most of the parties, I would say, to providing some kind of guaranteed income. We have only one program in this country that provides any kind of direct financial assistance to caregivers, and that's Nova Scotia. Many other countries do provide caregiver benefit programs. They're better, some are better than others, and there are eligibility criteria that makes accessing them somewhat limited, but it's not something that Canada, most Canadian provinces, have really been prepared to commit to. So, and the same is true of sending services home. That would make logical sense, right? You discharge somebody who still has care needs, you provide some services to them, and there's really, really good evidence that if you provide even a small amount of support to a family caregiver, it gives them enough resources to to do their jobs without as much of an impact on themselves, and bonus to the formal system makes them hang in longer, or gives them the ability to hang in longer. The problem is that the supports are provided so late in the game that it actually doesn't have much impact on a caregiver's longevity, because they're already over the edge by the time they qualify. That's my soapbox.
Yeah, Jane?
Yeah, I mean, I can't get into the policies and what's the right response, but just want to talk about my experience coming into this care economy project. And I think, you know, it really resounds with me, the invisibility of this work and the assumption in society that there are going to be family members who are going to do this. And the demographic trends suggest this may not be the case going forward. I mean, it may be, but and then the impacts on the caregivers themselves, which are today, and it has been like this for a long time. So that's why, you know, I want to promote this project that we're doing on trying to get national attention, because the data is important. And then the policy, like trying to get this more visible and trying to illuminate what's invisible, but it's gone on for a long time. And we have been talking at Statistics Canada forever about the aging of the population. Well, we haven't even got the tsunami of the aging of the population, by the way. Just look at the numbers about, you know, the number of 85 and older. So I think it's the visibility, it's having conversations like this are so important. It's raising these conversations, and its persistence on data and research are so important.
Excellent. Now, Ralph has asked, can you describe the relationship between Alberta, Caregivers Alberta, and the Alberta Health Home Care System? That's a question, I think, for Dr. Lewanchuk and for Jonna.
Well, the home care system uses as a variety of providers to provide more medical care in the home, and there's unfortunately no care provided to the family caregivers. If home care services are astute, they will do what we were just talking about, look at the wellness of the family caregiver, and hopefully provide them with the option or the ability or the knowledge to contact Caregivers Alberta. But again, it's our focus on the, you know, on the individual needing the direct care, and us again not being aware of the needs of the family caregiver.
Jonna?
Yeah, absolutely. You know, it is our job. That's why we exist, is to support that family caregiver. And so I mentioned that, you know, we are working really hard to build that awareness, not just at a caregiver level, but at an organizational level with other services and healthcare. And, you know, that's a giant system. You know, healthcare is giant. And there's just so many other community-based services out there. Like, we are making new connections every single day. So I think that we just remain focused on building those referral pathways and looking at, you know, how are people discovering us and seeing where the gaps are. And we're actively attempting to do that. You know, we're working with, we are trying to make more direct relationships with the variety of home care agencies across Alberta. So.
And I have to give a shout out here to the new Bill 11, because in that policy or regulations, they're expecting that if the family caregiver wants to have their needs assessed and be enrolled as a home care patient or client, that's part of what will happen in home care. So that's something new that isn't in effect yet, but is likely to be. Janet Smith is asking, finding out what's available often is made difficult by the actual time factor. And I think this is what Janet is also alluding to about technology. She doesn't have time to do the online research. So trying to find resources. I know from a study that was done in Quebec, 15 to 50% of family caregivers' time is now spent trying to find services, trying to access them, and then trying to manage them. What about some tips, how this could be better integrated as far as the system is concerned? Any suggestions?
Well, that's what our staff do, is they help with, finding and identifying resources in all regions of Alberta. So I'll just say that, again, reach out to us. We can attempt to help find services in an area or resources. And even if we don't know about it, we will go do the Google search. We'll go do the research for you and get back to you. But
I was just going to add that I think many people may not be aware of the services that 211 offers. 211 actually has a catalog of 35,000 resources in the province. And can even case manage certain people. They try to close the loop when they provide service, so not just provide a phone number, but make sure that people actually get the services that they need. So that's a fairly straightforward and simple way of doing it. At the primary care level, we're working on introducing social prescribing, and there's no reason why it wouldn't be for the caregiver, not just necessarily the person. Social prescribing being also identifying needs and linking people with those needs through individuals who go by titles of things like community navigators.
Absolutely. That support to access community services is a social prescriber is really good, but I'm going to ask about that invisibility with family caregivers, because oftentimes, again, those services are going to be focused on the patient. Is that going to be an issue with social prescribing as well?
It shouldn't be. One of the places we have to start formally in Alberta Health Services, for example, and I can't remember which 3 provinces, but we are not one of them that actually has on the formal health record the record of the family caregiver. So they have the emergency. We have the emergency contact, but we need to start with even there, and then again, it's at all levels asking about the wellness of the family caregiver.
And that's a really important point, because Canada has the 4th highest country of people without kin. So knowing who has a family caregiver and who doesn't is actually, Jane, can you maybe comment on that?
Yeah, I mean, I think this was a surprise to me. When I was thinking about these one-person households being driven mainly by aging of the population. So that's what I mean by looking to we're dealing with trends now that are difficult. So what's it going to be like in 10 years? So where are those family supports going to come from? And there's an assumption that it's going to be there, but it's not necessarily. We don't know yet what's going to happen there, but I don't think we can assume that. So kinlessness is, I actually came on that because there was an article out, I think CTV or someone in media, and I got reading this and I went, wow. But it actually came when I was speaking to different groups, and someone said to me, I have a friend, they're actually in their mid-30s and they have this chronic disease and they need support and they have no one. So it's not just elderly people. So I think it's a trend that we need to take into consideration and understand it better.
Yeah, so knowing who has a family caregiver and who doesn't have any supports at all. Ralph is asking, can an enhanced self-managed care program in Alberta help to support caregivers? So would more self-managed care be the answer? Don't all jump in at once.
I've been waving my hand. I think the short answer to that is no. Alberta Health Services and other agencies, public and private, can't find employees, can't find caregivers to take professional care providers to take those jobs. So how the heck is an individual family caregiver or care receiver going to find somebody to work for them anyway? plus all of the additional responsibilities that you take on as an employer, right down to income tax withholding. I'm not a big fan.
Jonna, any other comments?
Well, I can tell you that caregivers that are using the self-managed care, like that there's a lot to it. So that there's a lot of questions, which of course we can't always answer. We're not part of healthcare directly, but we do hear a lot of conversation about the challenges within how that is set up. But nevertheless, some people really do like it. So.
Right, and there's also another program in Alberta called the invoicing program that is halfway between self-managed care, and something to inquire from your case manager if you're interested in that. So which community organizations and active groups are most effective for connecting with rural and Indigenous communities in Alberta?
I threw my answer. I threw my answer in the chat box there, but rural and Indigenous communities. It was mentioned earlier in this conversation that there's a lot of multi-generational living that occurs in those communities, and so for us, in attempting to find those family caregivers, we're reaching out to a lot of family-based services and agencies in those areas. So that's sort of a key place where we go.
Who in Alberta, besides Home Care's limited respite day program and the persons with PPD funding for respite day program, is offering material supports for care, actual care, and not counseling and psychological help? So is there anybody that's offering financial supports at all, really, is the question. I can tell you about 6% of family caregivers access any of the income supports, like any of the programs through the federal government income tax credit program. Very few. Anybody know of any others? Everybody's shaking their head.
There are, of course, the EI programs for anyone providing end-of-life care or critical care. There's a leave component to that. This is for employed caregivers who can take a leave from their jobs in order to provide care, either end-of-life care or critical care. And they get a partial income replacement through the EI program. But that's certainly the only universal one that I know of. And as I mentioned earlier, Nova Scotia has a care benefit program that provides cash benefits to caregivers who qualify.
All right. Now, I will have one last question for all of you, all of our speakers today. Wouldn't it be wonderful, just finish this, wouldn't it be wonderful if, Jonna, do you want to go first, and then Dr. Luwanchuk and Jane and Janet last?
I think it would be wonderful if we did find a way to provide more financial supports for caregivers here in Alberta. I really believe that.
Dr. Luwanchuk, we're giving you a magic wand.
Well, it just starts with, wouldn't it be wonderful if at a system level, we really recognize the huge contribution of family caregivers, but also that's what the person, the individual and the family caregiver want, is to be able to be supported in their relationships.
Great. And Jane?
Well, of course, I want data because data is going to really make all of this visible. So it would be wonderful if I could, the data gap we have identified or filled. And in the system of national accounts, we start accounting for the unpaid care work in this country.
And Janet, last word to you.
Well, as a data geek, I first of all have to agree with Jane. But beyond that, I think it would be wonderful if we stopped making assumptions about family care always being there and caregivers being not just willing but happy to provide all of this care, no matter the personal cost, and started taking seriously supporting family carers. And by seriously, I mean really meeting their needs, understanding what their needs are, and trying to meet those needs, and not exploiting them, not taking their willingness to provide care to their family members as an opportunity to exploit them.
Excellent. And this has been an incredible session. Jordana's going to bring up the final slides because we have a hard stop at past. And so I just want to thank all the speakers today. You have been just wonderful. This has been, you have really made us smarter. So this webinar recording will be up on the AAG website in a couple of days. Check out the past webinar recordings. They are chock full of knowledge. It's the new year and you can become a member of the AAG now. So please check out our website. You are going to get a survey and please complete that survey following the webinar. Our speakers have provided us with lots of knowledge. Now you tell us how you think family caregivers should be supported, and you need to tell us. So please complete the survey that you'll get immediately after. So mark your calendars for the next webinars, February 22nd and March 16th, and thank you for attending. My wish for everyone is to have joy every day, some joy every day. Thank you very, very much for attending. And again, can't thank our speakers enough. Dr. Nora Keating said that these would be a fantastic group of speakers, and she was right.